seminars you have been doing, right?
Yeah.
Yeah. Okay. Okay. So this is how your second time. So, as per today's agenda, other speakers have.
Like once you test for everyone, let them be sure that they are audible, they are visible, and then you mute them after they test everything, sharing their screen, everything. Let them do it first. Before 3:45, we can do that.
Yes, ma'am. I am trying to share my PPT. Yours will go just.
Yeah. I will stop sharing. I will stop sharing. Yeah. Hello. It is very easy. Any problems? Ma'am, okay. From the mail you are logging in? हाँ, मैं बताती हूँ, उसको बात करने के लिए बोलती है आपसे. मेल से ही कर रहे हैं ना? मेल का डायरेक्टली ज्वाइन हियर है. क्लिक हियर टू ज्वाइन. क्लिक हियर. हाँ, मैं बात करती हूँ. ओके. हेलो, मिस्टर शास्त्री. हेलो. Dr. Ragini Agarwal is facing some problem. Can you please sort out?
Yeah, ma'am.
Yeah, please talk to her. Dr. Ragini Agarwal.
Let me see. Let me check.
Please talk to her. She said she cannot join the. No. हेलो, नीतू ज्वाइन नहीं किया क्या? हाँ.
Hello.
Hello.
Yes, am I audible, Vishal?
Yes, you are audible.
Okay,
and you are visible as well.
Okay. No, I in between there was a power trip happening and I lost you all.
I have sent a link to both Dr. Mangala Wani and Dr. Ragini Agarwal. Hopefully, because it's the same link, they should use actually their panelist link to just click and join.
Have you talked to Dr. Ragini Agarwal, because she is the important person to join? Dr. Ragini Agarwal, Vice President FOGSI.
Let me look at her. Do you have her number?
Should I forward you?
Please, ma'am.
I will.
Is my screen visible over there?
Sneha.
Hello.
And Dr. Ketan, is my screen visible there?
No, not it. You are, yes, you are visible, but if you are sharing the screen, if you are sharing the PPT, it's not visible. I have shared Dr. Ragini's number. Can you please call her?
Yeah.
And
Vishal, are you there online?
mail.
Vishal is online. Mr. Vishal.
Yes, sir. Yes, one second, sir. I just talking to Dr. Ragini. 1 second. Yeah.
I can see Dr. Satish Tiwari joined here.
Yes,
Hello, sir.
तुम्ही
Hello.
कशावर लिंक जॉईन करा तो जो नो रिप्लाय झूम वाला नाही लॅपटॉपवर पण कुठल्या ईमेलवर जो तुम्हाला विशाल शास्त्री नो रिप्लाय झूम वरून जो ईमेल आला ना ईमेल
Correct.
त्याचा जो लिंक आहे त्याचा लिंक वर तुम्ही लॉग इन करून क्लिक करा.
Sneha madam, can we just check my slides?
Yes. Yeah. Vishal, can you please make Dr. Tiwari's slide share possible?
I will share the screen.
Yeah. Dr. Ketan has to stop sharing.
तुम्ही तुमचा ईमेल ओपन केला का पहिले सांगा. ईमेल ओपन केला. ईमेल आयडी ओपन केला.
Hello.
Email. It's visible.
Yes.
हा ईमेल ओपन केल्यानंतर त्याच्यात तुम्हाला इन्व्हिटेशन आला असेल एक आयकॉन असेल त्याचा आपला फ्लायरचा जो फोटो आहे तो तुम्हाला दिसत असेल त्याच्या खाली तुम्हाला हा त्याच्या खाली तुम्हाला दिले बघा की पीसी मॅक आयपॅड अँड्रॉइड नी जॉईन म्हणून हा तर त्याच्यावर क्लिक करा हा बस हा क्लिक करा आणि झूम आहे तुमचा झूम वेट कर तुम्हाला कळेल.
Vishal,
झूम आहे तुमच्याकडे तुम्ही झूम डाउनलोड काल तर केलं होतं काही नाही हा नाही थांबा वेट करा आणि जॉइन विथ झूम म्हणून येईल आता ऑप्शन वर येईल बघा जॉइन विथ झूम
Slides.
काय अच्छा मग त्याच्यात हा प्रॉब्लेम का नाही याचा असा प्रॉब्लेम झाला की मगाशी डॉक्टर तुम्ही तुमचा ईमेल तुमचा हा जो लिंक आहे तुम्ही शेअर केला होता का डॉक्टर रागिनी अगरवाल यांच्याशी हा कोणाला शेअर नाही केलं ना अच्छा काहीच येत नाहीये एकदा तुम्ही विशालला कॉल करता तिकडे
Dr. Sneha madam.
विशालला कम्युनिकेट करतो हा
So, Dr. Satish,
hello,
you wanted to make your presentation, Dr. Satish?
Vishal?
Yes. Can you see my slides?
yes.
Yes, sir. We can very well see your slide.
Okay. If I am changing, is it okay?
Yes.
एक लिखा हुआ है कि this link is unique to you. एक तो आपको URL उसमें मतलब उसमें है तो अगर आप ईमेल में देखेंगे.
Sorry to interrupt, Vishal. Dr. Mangala is not able to join. So she is calling you.
एक लाइन लिखी हुई.
Hello.
Not share with.
Vishal.
Shailesh, 1 second. I'm seeing Dr. Mangala Wani. 1 second.
Yeah, please. That's what I was saying. Dr. Mangala is trying to call you.
मैम उसमें अगर आप टॉप्स and click here. Just click. click तो करिए.
Hello.
So,
Dr. Sneha madam, are you listening?
Hello. Yes. Tell me.
Yeah, slides you can see, there is no problem, na?
Yes, no problem, no problem. Absolutely no problem.
So around 4 o'clock, I will have to leave for 15-20 minutes.
Yeah.
I will join again at 4:30.
Okay, sure.
Okay.
I think for inauguration, if you are there, it will be great. If you can wait for first 15-20 minutes.
At what time is inauguration?
Sharp 4 p.m. Everybody is joining in. Everybody is joining in.
No problem.
FOGSI President and FOGSI Secretary General, both of them are going to join.
Yeah.
Madam has already joined, ICOG Chairperson.
The only problem is this webinar was finalized later. I had promised for some other webinar.
Okay.
At 4 o'clock.
Okay, okay.
I will leave at 4 o'clock. Ask them to complete my role in their webinar around 15-20 minutes.
Initially only.
Yeah, and around 4:30, I will join again.
Yes, sure, sir. No problem. Okay. See you.
Okay, bye.
Vishal,
Slide hogi, is pe share ho rahi.
I don't know what's the problem with Mangala.
Hello, Vishal.
Vishal, has it been sorted out?
Mangala should have tried earlier, no?
Dr. Mangala Wani is actually struggling, so I'm just trying to help her. 1 second, I'm asking myself.
And Vishal, after that, just try my slides. If it is moving okay, it's at your end.
Yeah. Let Mangala join first.
No.
Please,
That's
wait.
more important.
Yeah. She's struggling because she's clicking the wrong message, I think, wrong mail.
I think the last mail, if she can.
Yeah,
click,
it's written reminder, no reply. It's very clearly mentioned, click here to join, and immediately you join the room. In fact, very convenient he has made, but then I don't know what's the problem. Manisha, join ho na? तो जो mail है ना last from Vishal Shastri, त्याच्यावर directly ते mail open कर, join here to click लिहिला तिथे click कर, directly Zoom room ला entry आहे, काय password वगैरे नाही टाकायचे काही. ठीक आहे, कर लवकर.
Vishal, are you online?
He's talking, I think, Dr. Bharadva with Dr. Mangala is online.
कंप्यूटर में लगा हुआ है, निकाल दो. ये तो लगता नहीं बिना अडेप्टर के. इसका अडेप्टर चाहिए, वो वाला लाल वाला. ठीक है, रन दो फिर.
Yes, now my screen is seen. Hello. Can anybody give me feedback? Dr. Sebanti,
Yes.
my screen is seen.
Yes.
Ketan Bharadva.
Yes, yes, doctor. I can see
The
your
slides
screen.
are-
Yes, yes, I can
slides are
see.
moving.
Yes,
Okay, the slides are also moving. Huh?
yes, yes. Moving.
Okay. Thank you. Thank you.
Just a small message, I mean attendee link and the password. Just type.
Vishal, has Dr. Vani been able, have you been able to help her problem, Vishal?
Ma'am, yeah, Dr. Sanjay, I mean, she's actually trying, I mean, she's not able to join through the panelist link. I'm just trying to help her.
But what is the problem? Like if she clicks on that link that you have shared,
Hello.
isn't she been
Ragini,
directed?
have you joined?
The attendees is only which I have shared with all attendees, which is unique actually. So they should be.
Vishal,
नहीं होगा ना,
just check
नहीं
my
होगा. अभी
slides
मैंने वापस
once
से
if it
आपको
is
एक मेल
working.
जो
Can you
वही
share
मेल
the
फ्रेश
screen?
फॉरवर्ड किया है.
Share my slides on the
Click
screen.
here to join. That's all. Immediately you will be. नहीं अभी मैंने होस्ट को भी बोल दिया है कि आपको जल्दी से एक्सेप्ट करे करके. हाँ, प्लीज डू दैट. आई होल्ड ऑन.
Oh,
Hello.
am I audible?
Yes.
Okay, fine. So should I mute myself right now?
Yeah.
Should I mute myself right now?
Yeah, till the
Okay.
time our session is starting, you can talk. No problem.
Yes. Okay, fine. Ketan,
Hello.
nice to see you.
Nice to see you, sir.
We are, madam.
Hello,
Seeing you
sir.
after a long time. Hello.
Yes.
And
yes,
Shebani,
sir.
madam, how are you?
Yes. Good. Thank you. How are you doing?
I'm fine. Thank you.
Now it's getting late. I think we have to start. Has Dr. Jaideep joined? No, not yet.
So there was a problem with Zoom because they want a new version from 30th of May. So I had to also download the new version and then join in.
Yeah.
So that's what took time.
हाँ मैं वही मुझे ठीक है चलो.
दिखा क्या उसको? जीजू इसको लड़का को ठंडा पानी लाके रख देना, नहीं तो लड़का को ठंडा पानी लाके दे देना।
Hello, Jaideep. How are you?
I'm very well, sir. How are you? Good to see
fine,
everybody.
Yes.
Yeah.
Hello, Dr. Shailesh.
Hi, hello, Dr. Prashant. कैसे हैं?
ठीक.
Hello, Dr. Jaideep.
Hi, Dr. Sheela.
Seeing you
How's
for a long
everything?
time.
Yes, yes.
Everything fine, I think.
Everything
Just,
fine.
I think we are waiting for Dr. Mangala to join.
Yes, yes. No rush at all.
Okay.
Take your time.
Hello. Good
Hi,
afternoon.
Sneha. How are you?
I'm fine. Welcome. Welcome here.
કેમ છો કેતન ભાઈ મજામાં?
Hello.
ડોક્ટર જયદીપ કેમ છો મજામાં?
બસ fine.
Hello there, sir.
Good afternoon, Dr. Jaideep. Nice to see you after a long time.
Yes, madam. Thank you.
Hello, Manisha.
Hello everybody.
Hello.
Hi, Deepti.
Hello, sir.
Hello, Dr. Deepti. Hello.
Hello.
Welcome.
Yeah.
Hello. Hello, Mr. Vishal. Dr. Parag Biniwale is waiting to join. Please admit him. Hello.
हेलो तिवारी सर, कैसे हैं आप?
Hello, Deepti. Welcome.
Dr. Manisha Kuthe.
I sent out an email to Dr. Parag Biniwale. I think he should also join. I mean, it was already sent, but I mean, I resent the invite. He called me also.
Surely okay to dekhe now. Pare koro gulo. Surely okay time diye now.
Hello, Pradnya. Unmute your phone.
Hello, Vishal. I have talked with Dr. Parag. So I think he was saying the wrong mail. So there was no link.
Dr. Parag has got invite on 2 separate emails, and both have, I mean, speakers link.
Vishal, I think you have sent it on the another email. So I've asked him to check his different another email for the link.
Shailesh, I'm putting you on the other panel. I mean, is that fine, or you want to be here till the inauguration happens?
You are talking to me? Yes. Huh?
Hello. Hello.
Hi. Hello. Welcome, Ragini.
Hi, Sneha.
Welcome, welcome. Great to see you.
Yeah, finally.
Finally, please.
Yes.
I think Dr. Alpesh was supposed to join. He told me he will join for the inauguration. So
Yeah.
we are waiting for, we'll wait for 2 more minutes.
Yeah.
Vishal? Vishal, I received message from Dr. Parag that there is no link in the second email also. Can you check that?
Oh God.
Yeah, I don't know.
Actually, so much meeting on the Zoom. Now Zoom bhi hil raha hai.
Zoom हो रहा है. I think
Yeah. Right now in my house, in every room, one person is sitting with one Zoom.
Your house seems to be zoomed. डॉक्टर भारद्वाज थोड़ी कॉफी यहाँ भी भेज दीजिए.
Prashant Bhaiya, I wish I could just now.
हा पराग हे बघ हा नवीन फ्रेश मेल मी माझ्या ह्याच्यातनं फॉरवर्ड केलाय. हा प्लीज क्लिक कर त्याला आणि जॉईन हो लवकर. हा ठीक आहे ये. Hello, Dr. Pardesi. Welcome, Dr. Pardesi, sir, our advisor, breast committee. Sir, you have to unmute, I think. Vishal, please unmute Dr. Pardesi.
Hello, Sneha.
Hello, Parag. Welcome. Welcome.
Finally.
Yeah, finally. I think we are getting too late.
Okay.
Mangala is yet to join, but should we start?
I think if everybody has joined, then can't see Dr. Megh. Ragini ma'am is here.
Hello, hello. How are you?
I'm good.
I think you are the most busy person, Parag.
Kya cheez?
You are the most busy person today. 5 webinars, all ICOG. Dr. Parag is there.
Hello, madam.
That I have to join for you.
Vishal, please unmute Dr. Mandakini Megh. She wants to say something.
Okay.
Parag, we have approximately 800 registrations till now.
Huge number.
And we have 154 participants at present join. Should we wait some more or should we start the session?
I think if the dignitaries, I can see Dr. Jaideep.
Yes, Dr. Jaideep Tank is there. And I think only Dr. Alpesh. Hello.
So
बर आता पाठवते लगेच. ओके. हा. मी बिलकुल. Yes.
I can't see Dr. Mangala. Dr. Parag is joined. Dr. Mangala has joined in a different account, Praful Wani. So she is also the panelist. She is there. Ma'am, Dr. Mangala has joined.
Yeah, can't see. Please unmute Dr. Mandakini Megh. She wants to say something. And we start our inaugural session.
Hello, can you hear me?
Yes, Mangala.
Yes,
welcome.
hi.
Though late.
Madam.
After a very difficult time, ultimately,
Yeah,
my husband's
we have to hurry up. We have to hurry up and start with our session. Please start the program. Let Dr.
Everybody has come.
Mangala, please start.
So everybody's there, Sneha?
Yes, Dr. Alpesh Gandhi, I think he must be busy somewhere. He told me that he will join, but everyone else has joined. So we have to start.
How many participants we have right now?
158.
Sorry?
162 at present. But,
okay.
Yeah, but we have to start the formalities. We don't wait.
Okay. Hello, everybody. I welcome you all to this 3 days webinar series on update on breastfeeding organized by ICOG-FOGSI and Breast Committee FOGSI in collaboration with Breastfeeding Promotion Network of India, Maharashtra, IYCF chapter of IAP and Human Milk Bank Association of India, along with Alive and Thrive. And this is in fact a very prestigious certification course by ICOG-FOGSI and Breast Committee FOGSI. Breastfeeding is one of the most effective intervention which addresses both. There is some sound coming. I think
मंगला बोलते हैं ना, शुरू करते ती तुम्हाला करेल तो.
Vishal, will you unmute everyone, please? Breastfeeding is one of the most effective intervention which addresses both survive and thrive agenda of the child. Inadequate breastfeeding puts a huge burden in our healthcare system. FOGSI has recognized that and has taken the initiative to increase the awareness and to change the hospital practices. So I'm very thankful that the FOGSI has taken this initiative, and I'm also thankful to Alive and Thrive, who is our academic partner in this venture. So myself, Dr. Mangala Wani, welcome again to all the faculty and delegates. And now I invite Dr. Sneha Bhuyar to start the inaugural function.
Good afternoon, everyone. At the outset, I would like to thank respected FOGSI President Dr. Alpesh Gandhi, Secretary General Dr. Jaideep Tank, ICOG Chairperson Dr. Mandakini Megh ma'am, Secretary Dr. Parag Biniwale, Dr. Ragini Agarwal, Vice President FOGSI in charge Breast Committee, for allowing us this huge activity, and special thanks to Dr. Mandakini taking up this as ICOG certification course. I would like to welcome all my national coordinators, all my advisors, Dr. P.K. Shah, Dr. Pardesi, Dr. Mandakini Megh ma'am, Dr. Sheela Mane, Dr. Suchitra Pandit, Dr. Kavita Bapat, Dr. Archana Verma, Dr. Tarini Taneja, and so many, Dr. Hirema, Dr. Madhuri Patel, so many of my advisors. I would like to welcome all the coordinators from all the zones, from South Zone, Dr. Shaijas, North Zone, Dr. Mitra Saxena, East Zone, Dr. Indrani, and West Zone, Dr. Charu Bape. I would like to welcome all the dignitaries here and be very thankful to all of them for being a part of this activity. At the outset, I would like to request, actually Dr. Alpesh Gandhi was supposed to guide us, but because he is unable to join for this webinar, I request Dr. Jaideep Tank, Secretary General FOGSI, to guide us and say a few words about this activity. Jaideep, please.
Thank you very much, Sneha. This is indeed a wonderful activity on a much needed topic, that is breastfeeding. This is a topic which has been with FOGSI for a very long time. My father, Dr. D.K. Tank, was the president of FOGSI in 1997, and he had started the trend of having themes in FOGSI. And I very well remember that the theme in his year in 1997 was on breastfeeding. So again, a topic which is very close to my heart, and a topic which I have tried to advocate for and pushed for since more than 20 years now. In fact, I'm happy also to share that our hospital in Mumbai was one of the first baby-friendly hospitals certified by the government. So it's obviously a very important topic. This has already been said, and I'm loath to repeat. But I think it is my responsibility and pleasure, if you will, as Secretary General of FOGSI, to thank all the partners who are participating in this activity. We at FOGSI strongly believe that partnerships are force multipliers, and quite evidently, this participation shows in good light. So I'd like to thank all our partners, IAP, IYCF, BPNI, HMBAI, and ANT, Alive and Thrive, with whom we've had a very good, long and fruitful kind of partnership. I'd also like to thank the ICOG Secretary and the ICOG Chair for taking on this program and awarding it point, all the faculty for taking time out the Vice President, Dr. Ragini Agarwal, for supervising this activity. And I must mention a special word of gratitude and appreciation for Dr. Sneha Bhuyar, who has taken this activity upon herself and has coordinated, and we can see that it has come to a wonderful fruition. So congratulations, Sneha, well done. And we look forward to several such initiatives from you and the Breast Committee of FOGSI. Thank you very much.
Thank you so much, Deep, for very valuable words. And I'm so happy that you are a part of this. Your hospital is recognized for all this, and you are part of this initiative of breastfeeding programs. Thank you so much. I now invite Dr. Mandakini Megh, Chairperson ICOG, for her valuable guidance on this activity. Madam Mandakini, please. Vishal, please unmute Dr. Mandakini Megh. Oh God.
I can see her ID.
Madam, तुम्हाला बोलायचंय मी इकडे डिक्लेअर केलंय. अरे नाही केलंय मी सांगितलं परत त्याला. हा Madam Mandakini is not unmuted, I think. Please unmute her fast.
Has she joined with some other name, ma'am? Because I can't see her name.
No, she was here. Talk to her at least. Oh God. Please unmute Dr. Mandakini.
Was she there earlier?
She was here only.
She can unmute herself actually at her level itself.
Okay, I will tell her.
Just tell that she can unmute herself.
Hello, Madam Saleka. Hello. Madam, unmute झालात का तुम्ही?
On the left side of your screen at the bottom, there is an unmute icon.
Is she there online? Is she there online at present? She's calling me, but yeah, one sec. Hello. मॅडम तुमच्या लेफ्ट साइडला एक आयकॉन आहे खाली म्यूटचा, तिथे क्लिक करा प्लीज. नाही त्यांनी तुम्हाला अनम्यूट केलंय. प्लीज लेफ्ट साइडला जो आयकॉन आहे ना त्याला क्लिक करा. तुम्हाला नंबर फॉरवर्ड केलाय ना, कॉल करा त्याला लगेच. हा तुम्ही कॉल करा प्लीज, कॉल करा. मॅडम तुम्ही कॉल करा त्याला तो तुम्ही आयडेंटिफाय नाही होते त्याला. तुम्ही कॉल करा, मी नंबर दिलाय तुम्हाला.
So meantime you can invite the next.
I think she will speak first. Hello, Mr. Vishal, please unmute Dr. Mandakini. I think by the time Dr. Ragini. Hello. Is Dr. Ragini online?
Hello. Yeah. Hi, Sneha. I'm very much online.
Please, you say a few words regarding our breast committee and the activity. We would like to hear from you.
Yeah. Sneha, I can say only 2 words. I am thankful to Alpesh that she has given me in charge of a breast committee, which is led by such a dynamic person from you, like you. And the thing is that this 3-day program of the breastfeeding is a wonderful idea, because all the gynecologists should have an insight of the breastfeeding, not to send their patient all the time to lactation counselor. Because the faith what the patient has with you in the 9 months, they really want to understand the problem. They solve their problem with you. And my colleague, she's a gynecologist and she has done a breastfeeding course properly. And most of my patients, since then, she has started counseling. The thing has totally changed. So it is a very, very wonderful initiative. I congratulate you, and I know all the attendees who are going to join it for 3 days, they are going to immensely by it. And thank you making me part of this.
Thank you so much.
Carry on.
Thank you so
Over
much,
to
dear
you.
Ragini. Yeah. Is ma'am Mandakini ready with her voice? I would request Dr. Parag Biniwale to say a few words about this.
Thank you, Sneha. At the outset, let me thank you and your committee for tagging ICOG along. I bring greetings from ICOG, the Indian College of Obstetricians and Gynecologists, and I must say that it's a wonderful activity that we are doing. Mangala is doing annual conference on breastfeeding for last so many years. I can see Dr. Prashant Gangal here, who's a regular participant and a guiding force in that. So I'm really happy that you have formulated this activity, and I'm really happy to say that we will continue this as a certification course even in the long run. So maybe if you want to have this kind of an activity again, ICOG along with your committee, and of course all the partners who are very much here and who are proponents of breastfeeding, we all will take this further and as an ongoing activity. So all the best for these 3 days, and I look forward to learn a lot from these 3 days of intense. Thank you.
Yeah. Thank you so much, Parag, for your wishes. We would definitely continue this activity. I think Dr. Mandakini, has she been able to join? Hello. Hello. Hello, madam. Hello. I think Dr. Mandakini has not been able to join as yet. So I think should we take this activity ahead?
Yeah,
Ragini,
I think so.
Yeah.
Yeah, I think because
yeah.
everybody is waiting for the program.
Because we are getting messages already. 250 participants joined, and we are getting a message to start the scientific session. So I would like to thank FOGSI President Dr. Alpesh Gandhi once again. Thank you so much, dear Jaideep. You joined our program, and thank you for your best wishes. Thanks, Dr. Mandakini, Megh, Parag, Dr. Ragini, and all my advisors and participants. Thank you so much. Over to you, Dr. Mangala.
Yes, thank you, Sneha. And I'm really thankful to Dr. Jaideep, Dr. Parag, Dr. Ragini, the way they made the comments. It's really very motivating and inspiring to do the work further in breastfeeding. So now we'll go to actually the program. And first of all, I'm just going to invite virtually our 2 chairpersons, Dr. Mandakini Megh, which is, I think not on the screen yet, and Dr. Ragini. And first of all, since Dr. Mandakini is not here, I myself invite Dr. Sneha Bhuyar again to start her lecture. So Dr. Sneha, she is a chairperson of the breast committee FOGSI right now, and she is also past president Yavatmal OBGY Society. She was also a founder president of ISOPAP Vidarbha in 1819. She's an organizing chairperson of Criticare 2018. She works actively in rural areas, and as a breastfeeding committee, she has done a lot of work in last 2 years. And we've been working actually together, for the breastfeeding. And she's a practicing gynecologist, more than 23 years. She doesn't look that old. She has many awards. And I think if I just keep saying awards, her lecture time will be over. But just few, that she's a recipient of the Champion FOGSI Award in 2019 and recipient of the National Award of FOGSI Unsung Hero. And she's speaker for many national and international conferences. So Sneha, it is over to you.
Thank you so much. I think I'm not able to move this. Yeah, here. Thank you so much, Dr. Mangala. And thank you so much, Dr. Ragini.
Hello, Sneha.
Madam, welcome back. We were desperately waiting for you. Please stay.
Yes, yeah. So may I just say a few words as a chairperson ICOG?
Yes, madam. You are most welcome.
Can you just go back to the screen, please? Can you go back to the screen? Go back to the screen. Yeah.
Sneha, you just cancel your presentation.
Yeah, I've done.
Yeah. So good afternoon, everybody. Because again I joined, I have to delete my this thing, and again I thank Dr. Alpesh Gandhi, Dr. Sneha Bhuyar, Dr. Ragini, and everybody. So I welcome you all on behalf of ICOG. When Dr. Sneha has mentioned that we have got very comprehensive program for 3 days, then I initiated and I told her, why not to convert it into ICOG certification course? And this is the first course. It's a very prestigious certificate of ICOG, which we have collaborated with the breastfeeding and the breast diseases. And it was a very good idea that, as Dr. Jaideep has mentioned, that it is a subject of very, very great importance. It requires a lot of attention from the specialist. And Dr. Mangala Wani and Dr. Sneha Bhuyar has taken the lead. As a ICOG chairperson, I want to say that now at the ICOG, this is the very first certification course. So I congratulate Dr. Sneha, Dr. Mangala, and all of you that your course is the first course. Now there are series of courses which ICOG is going to, inaugurate later on, like MTP, abortions, endometriosis, and this is a very first course of the ICOG. So once again, I thank Dr. Alpesh Gandhi. I welcome you all, and I just want to inform that all of you on the third day, all of you, you have to pass you have to, see the MCQs, and after the MCQs, you will be examining, you will be given the certificates by the ICOG. I welcome Dr. Ragini. I was seeing you, but I could not actually talk because
hello, madam. Hello.
And Dr. Shah, Dr. Pardesi, I can see all of you. And I think you give us blessing because this is the ICOG first certification course for the social issues. So with that, I request Dr. Sneha to go ahead, and I will have to read her biodata. So you can display the biodata. So Mangala, should I chair the session?
Yes, I already actually invited you, but you were not available. And on your behalf, madam, I have introduced Dr. Sneha. But thank you so much for taking part in this webinar and, recognizing this as a certification course that will really increase the awareness amongst the obstetricians. Thank you so much.
Yeah. Thank you so much, Madam Mandakini. Thank you, Mangala. But before starting my talk, I would just request you to forward the fresh link to all the groups because I'm getting many calls regarding the login problems. So please share the fresh link to all the groups. Good afternoon. I welcome all of you for this scientific session. My topic of today's talk is benefits of breastfeeding. My topic of this talk is the breastfeeding in COVID-19 era. Considering this topic, we have to explore two aspects: whether breastfeeding is definitely beneficial during this era, and whether there is a risk of transmission through breastfeeding. So first we consider what are the benefits of breastfeeding to mother and to baby. As all of you will agree to me that breastfeeding promotes mother and child bonding, which is lifelong. It initiates uterine contractions and thereby reduces the uterine size, minimizing the incidence of postpartum hemorrhage and puerperal sepsis, which are two major causes of maternal mortality. With exclusive breastfeeding, this acts as natural form of contraception for first 6 months. Long-standing breastfeeding helps in reduction of excess weight of the mother which she has gained during pregnancy. also reduces the incidence of breast, ovarian, and endometrial cancer in the mother, and it saves time and the expenses as well. What are the benefits of breastfeeding to baby? This is the best possible nutrition available to the child. It has all the ingredients necessary in appropriate amount. It is aseptic, at proper temperature, easily digestible, and it reduces the incidence of cough, cold, infections, and diarrhea in the baby. It also protects the baby from colic, asthma, eczema, allergies. It is essential for optimal physical, mental, and emotional growth of the child. It contains various protective antibodies like secretory IgA, IgG, and IgM antibodies, which protect the baby from various bacterial and viral infections. It contains lactoferrin, which inhibits the iron-dependent bacteria and GIT, and also it contains lysozymes, which protects against E. coli and Salmonella. Of course, the biofeeder supports the growth of normal healthy flora in the gut. For this, to promote breastfeeding, we have to see that the mother and mother's physical and psychological health is good. We have to maintain well-balanced, very diet with plenty of fluids, supplement her with iron and vitamins. She has to avoid caffeinated drinks and alcohol. Now, when we talk about this current pandemic, we need not go into the details of this coronavirus. Just one thing, that it has a spike, which is protein, which binds to the surface of the host cell. These are the manifestations everyone knows. But what is our concern? Recently, because there have been some studies that some babies are positive shortly after birth. So we have to see whether it is a vertical transmission or transmission because of breastfeeding. How do we protect while she is pregnant? No, because this virus has been there active for only last 4 to 5 months. There is very limited data that can be validated. But based on few case studies, research, and articles from various countries, we have come to some knowledge and direction. Now, does pregnancy increase the risk? As all of you know, that pregnancy is basically an immune compromised state. And she is susceptible to most of the infections, rather the day-to-day infections, respiratory infections, common cold and flu as well. So is true for COVID. So nothing specific higher incidence for COVID, but as you all know, that because this corona infection is the major target is respiratory system, and because of pregnancy, especially the third trimester, because of the rising height of gravid uterus, elevation of the diaphragm, there is decrease in lung compliance, and that is why it can be more harmful to the mother. Now, mother to child transmission we are talking about. As we know, till date, transmission of corona during pregnancy is unlikely. But after birth, the newborn is susceptible because of person-to-person contact. Now, very small number of babies have been tested positive soon after birth. So, but we have to see whether, I think, Mangala, you have to mute yourself. Mangala, you have to mute yourself. Because this is whether due to vertical transmission or because of breastfeeding, that we have to decide. But this virus has not been found to be present in amniotic fluid or even breast milk. But if you have heard few days back, Dr. Asha Singhani's talk on Justice's program, she has said that she has reported virus present on the surface of placenta in some studies. In one case of baby of a COVID positive patient, the baby was tested to be negative for the virus, but was found to have some antibodies, IgG type of antibodies, which may indicate vertical transmission. ICMR has also reported similar study and quoted the possibility of vertical transmission. Now, we are sure that there is no vertical transmission as yet. We are now know we now know that it is because of breastfeeding. So whether it is from the breast milk or because of the touch, that also we have to decide. So we have already heard that coronavirus is not found in the breast milk. but it is transmitted because of the close personal contact. And because of this, some mothers, what they have decided, or some doctors also, they have advised separation of mother from the baby, and she has to follow respiratory and hand hygiene, express her breast milk either herself or with the help of caretaker, and feed her baby with her breast milk. But WHO says that this separation is not necessary. Should mother be separated? UNICEF, WHO, CDC, and Academy of Breastfeeding Medicine, all of them, they say that separation of mother and baby are not at all necessary. In fact, if the mother is able to take care of herself and her baby, they should be kept together. Now, they can be kept together, but can she breastfeed the baby directly? Now, considering the benefits of breastfeeding and insignificant role of transmission from the breast milk of the other respiratory viruses till date, mother can continue to breastfeed because the risk of transmission is almost negligible through breastfeeding, provided she follows the proper hand and respiratory hygiene. Now, WHO, UNICEF, International Lactation Consultant Association, Australian Breastfeeding Association, Canadian Pediatric Society, Academy of Breastfeeding Medicine, and FOGSI, all the national and international guidelines, they agree that breastfeeding should be continued and be supported during this COVID pandemic with appropriate precautions. In fact, it is said that breastfeeding protects the baby particularly against the infectious diseases, and the antibodies which are transferred to the baby from the mother, in fact, it protects the baby from that particular disease. So is true for COVID as well. So there is no need of separation. She can breastfeed directly, provided she takes proper respiratory and hand hygiene precautions. Mothers and infants should be enabled to remain together in a room day and night, that is rooming in with skin to skin contact and kangaroo mother care. In fact, this is necessary for the establishment of breastfeeding, whether the mother or the infants have suspected or probable confirmed COVID-19, provided they take proper hand and respiratory hygiene precautions. Now, whether the patient is suspect or confirmed COVID-19 patient, if she is symptomatic, she has to follow all the precautions. What precautions she has to follow? She has to herself wear the mask and even put a mask for the baby when he's not feeding. She has to follow the proper respiratory hygiene. In addition, that means she should avoid coughing or sneezing on the baby while feeding. She has to cough or sneeze away from the baby. She has to wash her hands every time before she touches the baby, her breast and nipple areas, the breast pump or breast, the whatever bottles or utensils, whatever she is using, if she is doing feeding with express breast milk. This is what WHO guidelines are. Now, when COVID-19 complications prevent this mother, if she is critically ill, if she cannot take care of herself or her baby, then she needs a caretaker who is COVID negative. And for this, she has to follow all the hand and respiratory hygiene, and she has to use the dedicated breast pump, the breast bottle, and the utensils, whatever they are using, they have to strict adherence to sterilization. Now, as we have decided that breastfeeding, whether directly on the breast or express breast milk, can be used. Now, there comes the question of storage of this breast milk. According to Academy of Breastfeeding Medicine, WHO, CDC, and FOGSI, they intend to breastfeed and provide milk to baby. They are encouraged to express milk to initiate, build, and maintain the milk supply. So, how do we go ahead with storage of this express milk? Naturally, if the breast milk has been expressed cleanly and safely, you can store it at room temperature for 4 to 6 hours in the refrigerator at 4 degrees Celsius for 3 to 5 days, and in the deep freezer at minus 18 degrees Celsius for 6 to 9 months. Now, this frozen milk, when we want to use, we have to thaw it. We have to thaw it in the lukewarm water, and we have to use it over 24 hours. If we cannot use this thawed milk before 24 hours, we have to discard it. We cannot refreeze it once again. Now, direct breastfeeding, feeding with express breast milk, these are the options. But sometimes it happens that the mother is so critically ill that we cannot do all these measures for her. So in such situations, we can offer these alternative options, this relactation. That means we can restart breastfeeding after a gap. We can wait for her approval and then we can restart breastfeeding, or wait nursing. Another breastfeeding mother can care for the child, or we can use donor human milk. Now, donor human milk, even though we say it is pasteurized, there is no evidence whether it kills COVID-19 or no. So, best option is either the same mother or wet nurse. We can use express breast milk, which is stored, that also can be used. So, we have already summarized all these things, that she has to follow the hand and respiratory hygiene very thoroughly. She has to practice all these things, and that is why to promote the breastfeeding from her own milk or express milk, we can continue breastfeeding with the proper precautions. Now, just to summarize, breastfeeding is more beneficial to fight on the current situation because it is much more beneficial, and there is negligible risk of transmission. We have to continue with breastfeeding provided precautions for prevention are taken properly. Preferably breastfeeding, if not possible, COVID negative mother has to take care for the COVID positive mother, and can use alternative supply of breast milk, as we have said, wet nurse and human milk. So mother's milk has more power than the virulent attacks. So I think we are very sure that there is no risk of transmission, but much more benefits are associated with breastfeeding, and that is why all the international organizations recommend to continue with the breastfeed. So thank you so much for this patience hearing, and I would like to hand over this to Dr. Mangala once again. Hello. Hello, Mangala.
Unmute कर लीजिए डॉक्टर मंगला.
Unmute करा.
Unmute. Mangala.
Okay. Ragini is a chairperson.
Yeah, Ragini.
Hello.
Yeah.
Can you hear me now?
Yes.
Yes. Thank you so much, Dr. Sneha. And it was really very lucid, very self-explanatory. And we will take the questions at the end of the session. Thank you. Now I request Dr. Ragini madam for the next lecture. The next lecture is Dr. Sebanti Ghosh, and I request Dr. Ragini to introduce her.
So after the lecture of Dr. Sneha, we are very clear that COVID infection is not a prohibition to breastfeeding to the babies. Now I have a very important person to introduce who is well known in the field of the breastfeeding, Dr. Sebanti Ghosh. She is the project director of the Alive and Thrive, and I think most of the people know what is Alive and Thrive. Just a few words about Alive and Thrive. Alive and Thrive is a global nutrition initiative to save lives, prevent illness, and ensure a healthy growth of mothers and children. And it is supported by the FHI solution and funded by Bill Gates Foundation, Irish Aid, UNICEF, and the World Bank. Madam Sebanti Ghosh is going to explain us global policies around the breastfeeding. Over to Dr. Sebanti.
Yeah. Thank you so much, madam.
Thank you, Dr. Ragini. Requesting Vishal to share my screen. Vishal, first of all, let me thank the ICOG-FOGSI IPIYCF chapter, Human Milk Bank Association of India and BPNI Maharashtra leadership for this collaborative effort and for having us as a partner and giving me an opportunity to say a few words. And thank you also for introducing what Alive and Thrive is. Vishal, the next slide, please. We, as Dr. Ragini mentioned, as part of a global multi-year nutrition initiative, we are providing technical support to government as well as partner organizations and professional associations like you for strengthening the policy and program agenda on maternal, infant, and young child nutrition. The next slide. Let me just take a step back. The Lancet 2016 breastfeeding series had clearly highlighted the importance of breastfeeding. And as one of the key persons in World Bank, the Vice President for the Human Development Department had mentioned that if breastfeeding was being invented now, it would call for 2 Nobel Prizes, one in economics and one in medicine. So what did Lancet 2016 tell us? That when we scale up breastfeeding to a near universal level, we are able to save lives of 800,000 under 5 children annually in the 75 high mortality, low and middle income countries. And we can save also additional 20,000 maternal lives annually from breast cancer. When we are achieving breastfeeding at a universal coverage, a near universal coverage, we are able to prevent 54% of diarrheal episodes and 32% of respiratory infections. And we know they are still the major killers for our under 5 children. And very important, breastfeeding improves cognitive potential and human capital development. We have recent evidence on how early initiation of breastfeeding in the first hour of life not only just prevents infection-specific mortality, but we can see the risk when an infant is initiated after 1 hour, that infant has almost 33% greater risk of neonatal mortality. The next slide, please. Where are we?
Hello, Dr. Sebanti.
Hello. I think she lost the connection. I think so. She has lost the connection. Internet connection is gone. Yeah.
Let me call her.
So that is, I don't know. Mr. Vishal is here because they have sent by email. Only email.
Dr. Sneha, I think there is some power cut at Dr. Sebanti's place. So probably we may have to go ahead.
So I think Mangala, you can invite, I think let
So
the chairpersons, Let the chairperson say something and you invite the next speaker.
Can we stop this sharing this presentation then, Vishal? Yes. And now we'll go for the next lecture. If Dr. Sebanti comes back, maybe we can continue at the end. So Mandakini, Megh madam, now I request you to introduce the next speaker, and that is Dr. Pradnya Supe. Megh madam, are you there?
I'm there.
Yeah, so will you introduce the Pradnya Supe madam, please?
I will do that. Don't worry. 1 minute.
Yes.
I'm just finding out her.
Yes, I can see Pradnya has downloaded her presentation. Thank you.
Can I complete my presentation, please? I'm back. There was a storm and I lost the power. Hello?
Right, okay, you can continue. Yes.
Okay. Vishal, can you please share my screen?
Dr. Pradnya should stop the screen sharing first.
Yes, ma'am, I'll do that.
Sorry for the inconvenience.
Yeah, please continue.
Yes. Vishal, please share the screen. As I was saying, while we have made progress, there are still some challenges. And if we look at the cost that we incur for not breastfeeding, it's huge. It is $14.5 billion US. And we are among the top 5 countries who have such high cost due to mortality, morbidity, health system, and cognitive loss owing to not breastfeeding. The next slide, please. So in the midst of all this, we have the COVID-19 pandemic. Next slide, please, Vishal. Next slide, please. So we have a recent publication based on a list modeling exercise which got published in the Lancet Global Health. What are we seeing due to the disruption in the health system functioning and decreased access to food? How is maternal and child mortality being affected? So they have 2 scenarios. One is the least severe, where we are seeing a coverage reduction of 10 to 18% and wasting increasing by 10% over 6 months. It is resulting in over 250,000 additional child deaths and 12,000 additional maternal deaths. In the most severe situation, where the coverage reduction of essential MNCH services is somewhere around 39 to 52%, and wasting increases to 50% over 6 months, we have almost 11,57,000 additional child deaths and over 56,000 additional maternal deaths. And these additional deaths represent almost are in a range, an increase between 10 to 44% in the under 5 mortality rate, and also 8 to 39% increase in the maternal death per month. So we can understand how the maternal and child health services, due to disruption because of the pandemic and the disruption in access to food and resulting wasting in the children, can really derail us, and all the gains in maternal and newborn and child health might be on a setback pathway. Next slide, please. So in this context, it becomes extremely important that breastfeeding and human milk use is highlighted, and I'm so glad the way FOGSI leadership is emphasizing on it. And we must not forget that breastfeeding remains the best source of nutrition, and it provides protection to survive and thrive even in these challenging times. The next slide, please. Most of these guidelines have been already highlighted by Dr. Sneha very well. of what the global guidance is led by WHO, and it speaks of early initiation of breastfeeding within 1 hour, exclusive breastfeeding for 6 months, and then continuation of breastfeeding for 2 years, along with introduction of complementary feeding after completion of 6 months and age-appropriate complementary feeding. But in all this, the emphasis is on respiratory hygiene, hand hygiene, and disinfection of surfaces that are frequently touched by the mother or the caregiver in the family, so that the mother is able to breastfeed safely. And when she requires support, when she is unable to directly breastfeed, I'm not going to go into the details. The options are expression of breast milk and feeding the breast milk. And even if that is not possible, pasteurized donor human milk. And in all scenarios, the recommendation is do not separate. Enable the mother and the newborn to practice skin-to-skin contact or kangaroo mother care as needed, and let them be together, taking due precautions. But for all this, the importance of breastfeeding counseling and support, including psychosocial care, is very important for the pregnant woman and her family members, and for the general community to do away with various misconceptions and the fear that is eclipsing our thought process that breastfeeding may not be the best option, or there may be a risk of transmission. Next slide, please. And in tune with the global guidelines, this is a very good decision tree that WHO has shared for practicing in community and health facility setting. And it speaks of the various steps that even Dr. Sneha mentioned and which I briefly touched upon in my last slide. So the next slide, in tune with this global guidance, what is the national government, the Ministry of Health and Family Welfare coming out with? So in all the guidelines that is coming out through the ministry and being sent to the state, maternal, newborn, and child health and nutrition services recognized as essential services. The key principles are they are prioritizing teleconsultation, home visit, depending on the zone that the pregnant mother and a family is living, to track pregnant women, particularly the high-risk pregnant women and those in third trimester, to manage any complication, and also for timely institutional delivery with adequate transport backup. And then as part of the care at birth, it is recommending ensuring skin-to-skin contact and early initiation of breastfeeding within 1 hour of birth, and mother and baby being cared together irrespective of the COVID-19 status. But there is a major focus on respiratory and hand hygiene, education and maintenance for the breastfeeding mother. And there is a provision of creating COVID-specific labor room, postnatal ward and neonatal facility within the health facility setting, or having a separate COVID facility where you can address the needs and provide the relevant services to a pregnant woman who is COVID positive. And at the same time, counseling and supporting exclusive breastfeeding at discharge, and later on through either home visit or teleconsultation through the various ongoing programs of the government through the frontline health workers. But ICMR had recommended temporary separation of confirmed or suspect COVID-19 mother after discussing the risks and benefits with mother, but it has emphasized on express breast milk, and nowhere there should be any promotion of breast milk substitute, feeding bottles, teats, or pacifiers. The next slide. And here I end. So with the intent that we have all of us who are part of this webinar, we must all come together to empower and enable mothers to breastfeed during COVID-19. We cannot lose the gains that we have made in maternal, newborn, and child mortality in this current pandemic scenario when our health systems are burdened with a new challenge. So thank you once again. I'm sorry for the inconvenience in between.
No problem. Thank you so much, Dr. Sebanti. That was very nice information and very detailed explained. Thank you so much. We'll take any questions if there are at the end of the session. Now I invite our chairperson again, Mandakini madam, to introduce Dr. Pradnya Supe.
Hello, that was Sebanti. That was a very, very wonderful presentation. And you could guide us through the ICMR guidelines. And in the COVID period, what are exactly the situation of the breastfeeding? Very, very important to all the panelists, very important. So now we move on to the Dr. Pradnya Supe. 1 minute, I'm going to read her biodata. 1 minute. So Dr. Pradnya Supe, she is the Assistant Professor of Department of OBGYN at LTMG, that is Sion Hospital. She is a member of MOGS Youth Group. She is a Joint Assistant Secretary to the Journal of OBGYN, Jogi. She is a undergraduate and postgraduate teacher. She is a facilitator of Sneha and there are multiple publications. And most importantly, she is the new fellow of the ICOG. Last year, I motivated her to become the fellow, and at my installation as ICOG chair, she has taken the ICOG fellowship. So welcome Pragya to the ICOG family, and she's going to talk on practical difficulties and experiences during COVID-19 times. So Pragya, the floor is yours.
Thank you so much, madam. Am I audible? Yeah. So we have heard guidelines about breastfeeding and COVID till now. I am not going to be really speaking about guidelines because Dr. Mangala Wani really wanted me to speak about the practical difficulties and experiences that we have faced while managing COVID-19 pregnant patients. So I am going to speak not only about the problems with breastfeeding, but what problems we had from the beginning since we started really getting this COVID-19 positive women. So as all of us know, the first case of coronavirus was detected in India on the 30th of January. On 4th March, 22 new cases came to light. Let me talk about what I have in my hospital. I work in a tertiary government, municipal corporation based tertiary care institute in Mumbai, that is LTMMC and LTMGH, more commonly known as Sion Hospital. Till date, we have delivered approximately 190 plus COVID-19 patients. These have been both normal delivery and LSCS from 1st of April till 31st of May. So what were the challenges that we faced while delivering these patients? The first one of them was training of our residents. As madam has advised again and again that this is a very novel coronavirus. So we were all very clueless about how to go about managing these patients. So all our residents underwent a rigorous training about the various aspects of COVID-19. They were taught about how to take a nasopharyngeal and a oropharyngeal swab, and they were told that these swabs had to be taken with complete personal protection. They were also enlightened regarding how to don and doff the proper way of donning and doffing the PPE, or what we commonly now known as the personal protective equipment. The other challenge we had was, like madam had mentioned, creation of a separate area for delivering and operating all suspect and known COVID-19 positive patients. So our hospital very early, by the end of March, we had designated a separate OT where we could operate or deliver these COVID-19 suspect and proven patients. Why we had chosen that OT in particular was that it had a separate AC unit, so any aerosol spread was further prevented. This area was to be shared by all surgical specialty and for only emergency cases. This arrangement was manageable by us, but by the end of March and by the beginning of April, our number of COVID positive patients really started increasing. So then we had no option but to convert our existing labor OT complex, where we normally had all non-COVID patient deliveries. We had to make certain arrangements that we could deliver suspect COVID positive patients there. So what arrangements did we make? As per MCGM and ICMR guidelines, we were sending swabs, that is COVID-19 swabs, of all patients who were within 15 days of delivery and all patients who came to our labor ward in active labor. Also, swabs of patients were sent who came from the high risk and containment zones. The biggest problem that we faced was that the time interval between sending of the swab and getting the report was approximately 24 to 36 hours, as our institute was not the primary center for testing. So we were forced to deliver or operate these patients without knowing their COVID-19 status. So what we did was, we created a donning and a doffing area in our existing laboratory complex. Separate areas were designated to be donning and doffing areas. We started conducting every delivery and LSCS in complete PPE kits. These PPE kits, I will be showing a picture. All staff and residents, they were working in shifts and they had to be in PPE kits throughout. Also, due to this delayed time interval between the testing and the report coming, we had to create one of our existing wards into a holding area where patients, mainly postpartum, whose swab reports were awaited, were kept. This is a picture of how we had designated a donning area and a doffing area. In both these areas, specific sequences on how a PPE kit has to be worn, in what order, and how it has to be doffed in proper order was also mentioned, so that everybody who is doing it has it as a checklist. This is how in PPE kits, you can see both the anesthetists, the staff nurse, the class 4 workers, everybody is in PPE kits now. The next challenge that we faced was creating a separate ward for the COVID-19 postpartum patients. So due to our increasing numbers, we were forced to create a separate ward over only our postpartum COVID-19 mothers. This was a 42-bedded ward, which was equipped with oxygen and other facilities. It was mainly managed by OBGY residents with faculty supervision on a rotational basis. The next challenge when we started delivering COVID patients, the one challenge which we faced was whether babies should be kept with mothers and whether breastfeeding should be advocated. Now we have already seen the guidelines which Madam has presented, Dr. Sneha Madam, Dr. Ghosh Madam has presented. But at the time when we actually started delivering these patients, we were a little unaware of exactly what we were supposed to do. So we saw what were the guidelines, ACOG, WHO, all of them recommended to keep the baby along with the mother. So as per these existing guidelines and after discussion with a neonatologist, we kept all babies of COVID mothers with them in the ward, unless these babies really required a TCU or NICU admission. All these mothers were advocated and counseled to breastfeed. Before breastfeeding, these mothers were counseled, whatever points had come up in the last 2 lectures, wash hands frequently, wear a medical mask while feeding, sneeze or cough into a tissue, immediately dispose it, frequent washing of hands, and regularly clean and disinfect services. Again, here, the problem that we had was, as we were not getting reports immediately, we were going ahead with early initiation of breastfeeding. All the mothers who came COVID-19 positive and after maybe 24 hours after delivery had started with early initiation of breastfeeding within 1 hour of delivery. After confirmation of reports, most mothers were willing to continue to breastfeed and are doing the same. The babies who are away from the mothers, in most cases due to the mother being critical or because of some logistic reason, or when the baby needed a NICU or a TCU admission, were given either express breast milk of the mother or they were given donor milk through our milk bank. We, Sion Hospital, we have the first milk bank of Asia, and we do have a lot of donor mothers, and then milk is properly pasteurized and stored. So this donor milk was given to babies who the mother's express breast milk could not be given. The express breast milk was collected after maintaining proper hygienic practices. The swabs of all the babies were sent after the mother's report came positive. Till date, we have had at least 193 COVID positive patients who had delivered with us. Of 193 patients, we have had 12 babies who have come positive. Of them, 7 have been discharged. 1 continued to remain swab positive even after day 10, but was asymptomatic. 5 babies are still admitted and are asymptomatic. We did not have any positive baby to date who was symptomatic and had required any more care than just observation. So basically, what were the problems that we faced while delivering these COVID positive mothers? Being a COVID positive has become a huge taboo in our society, especially in the general public. Because of this, most of the patients, in spite of coming positive, were not willing to stay in the hospital with the fear that either their babies who are negative or their relatives would contract the disease. There was a lot of difficulty of these patients and relatives to accept the fact that the mother had come COVID positive. to wear masks. See, it was very easy for us to, all the guidelines say that these patients have to wear masks while breastfeeding, they have to follow hand hygiene. But practically it required a lot of counseling, and it still requires a lot of counseling for these mothers, especially the kind of low socioeconomic patients who come to our tertiary level hospital. It requires a lot of counseling for them to wear a constant mask and to follow hand hygiene. Also, few mothers were extremely anxious to breastfeed their babies when they were afraid that their babies would get infected by it. Also, due to the COVID positive status, it was not possible to have relatives along with the patients. Our staff and residents have been really, they have counseled these patients and really helped them with their breastfeeding issues and other postpartum issues. One thing that has really come up now is that these patients should have a birth companion or designated birth companion who should be with them from before delivery, and this companion should also be tested, and that companion can be with the patient throughout. We are trying that if possible we can look into the matter. So I would just like to end my talk saying that there is very limited data currently available, but it indicates that pregnant individuals are not at a high risk of developing the disease as compared with the non-pregnant individuals. Only pregnant patients who have certain comorbidities or severe illnesses with the general population, they are at more risk of having a COVID-19 status. There is no conclusive evidence of vertical transmission, and exclusive breastfeeding should be encouraged even in these COVID-19 patients. At the end, I would like to say that in spite of us delivering such a high number of COVID positive patients, I would like to make it clear that we are not a COVID facilities, and we have been delivering equal number from the month from 1st April to 31st May. We have delivered around 935 patients. Of them, around 193 patients have come positive. So we are delivering a lot of non-COVID patients as well. So the biggest challenge that we have faced is really isolation of these COVID-19 patients. I would like to acknowledge our HOD, Dr. Arun Nayak, Dr. Swati Kulkarni, our Associate Professor, Department of Neonatology, and especially to all our staff and residents who have been tirelessly working in this corona pandemic. Thank you.
Yeah, thank you, Pradnya. It is an amazing work that you are at Sion Hospital. And it's very encouraging to know that, the very less number of babies are being affected, in spite the mother being positive. Thank you so much, and we'll take the questions again at the end. And now I request Ragini madam to introduce the next speaker, Dr. Satish Tiwari sir. Is Dr. Tiwari sir there?
Okay.
Yes.
Yes.
Thank you, Mangala. Welcome, Dr. Tiwari.
Yes.
Dr. Tiwari is a professor in Amravati Medical College, but the main introduction of Dr. Tiwari is he is a founder of IMLEA, which is a medico-legal ethics association, and he is LLB also, and we have associated almost 10 years with Dr. Tiwari, and I did one of the annual conference of IMLEA in Gurgaon also, and I know we are going to benefited a lot by the deliberation of Dr. Tiwari. Welcome, sir.
Thank you, madam. Ragini madam, it was not one of the conference, it was the first conference of the Medical Legal Association.
Yeah.
I have the credit to start the annual conferences of the Medical Legal Association. And thank you very much for that. Today we will be discussing something very important about the IMS Act, Infant Milk Substitute Act. And it's very important. We are discussing exclusive breastfeeding for last almost 1.5 hours now. But when it comes in practice, we do not see what we preach. So we do not follow what we preach. And it is not, I am saying something about IMS Act. The basic problem is that the Constitution of India, according to our Constitution, it is the basic and fundamental right of each and every individual. And according to Article 21, it guarantees protection of life, right to livelihood. Article 31 gives about prohibition of abuse of children of tender age. And Article 47 describes the duty of state to raise the level of nutrition, the standard of living, and to improve the various things. Universal Declaration of Human Rights, there are many fundamental human rights which promote and respect of these rights and freedom, and adequate health and well is one of the rights. Motherhood and childhood are
Bluetooth device is ready to pair. Bluetooth device is ready to pair.
Vishal, please unmute everyone.
Please mute everyone.
Sorry.
Bluetooth device is ready to pair.
Now this IMS Act, though it is an Indian law, it's not only that Indian government wants such laws, it is based from the international code. And according to international code also, teats, bottle, infant milk substitute, they are not banned in international code, but in IMS Act, these are banned. We'll discuss subsequently what international code wants to regulate the promotion and sale of this act. And according to international code, they have issued specific directions to the government that they can frame their own specific rule depending upon country to country. And so the IMS Act was enacted in 1992 and it was subsequently amended in 2003. Now, according to this IMS Act, which full form of this act is Infant Milk Substitute, Feeding Bottles and Infant Food Regulation of Production, Supply and Distribution. So just please go through the title of this act. It includes production, supply and distribution, and not only infant milk substitute, feeding bottles and infant food. And according to this act, it bans advertising and promotion of infant milk substitute, feeding bottle and infant food by any media, electronic or print. Unauthorized labeling of product is banned, including the complementary food such as images of mothers and children on the pack of the tin, and the supply and distribution of this is also restricted. So restriction includes the distribution of even educational material, advertisement and sponsorship and gifts and fellowship, everything. So even scientific programs are also banned under this act. And if there is a violation of this act, the penalties include imprisonment not less than 6 months and up to 3 years of age, and fine from 2,000 to 5,000 rupees. Unfortunately, this is the present situation. These are some photographs for last month in the COVID pandemic. If you look at the first photograph, it is from a live webinar which is arranged by Abbott Nutrition and Docplex. Now, such type of scientific program also cannot be sponsored by the companies which are banned under IMS Act. When we discussed this with some of our colleagues, unfortunately, they were of the opinion that if this program involves something related to child nutrition, then only it is banned under the IMS Act. In this first photograph, you can see the topic is managing infantile colic. So it is not on nutrition, but it is sponsored by a company banned under IMS Act. So this will be a violation of IMS Act. And I will request all those who are listening to today's webinar that I don't think that if you are doing something good, you will be short of funds. So please do not take funds or sponsorship from the companies which are banned under IMS Act. If you want the list of those companies, we can give it to the various organizations. We can give it to the Mangala Wani madam, Sneha Bhuyar madam, anybody those who want. We can give that list. The second photograph is of a pharmacy where if you see the list is of baby and infant food and supplement items. So Nanpro 1, 2, 3, 4, Cerelac, Cerigro, and then Similac stage 1, 2, 3, all these. Now, though the selling of these products is not banned. It can be sold, but the companies which are promoting or which are manufacturing this product, they cannot give some advantages depending upon the sale of this food. And all this advertisement is to increase the sale, and that's why it is violative of IMS Act. The third photograph is much more distressing because it is a supplementation of food material done by the armies and the police personnel during this pandemic. And what they are distributing is powder milk. Now, please remember, if your child is less than 6 months, then there has to be exclusive breastfeeding. There no need for any formula milk. Dr. Bhuyar madam has already covered in her talk. And if the child is more than 6 months, you can give complementary feeding. In emergency, for any reason, the breast milk is not available, you can start early complementary feeding, maybe around 4 to 5 months. I hope all of us remember that when these products like Cerelac, Farex were very much in use, they were started at the 4 months of age. So for any reason, if mother's milk is not available for a child who is 4 or 5 months, which is very, very rare, I may say it is 1 in lakhs, in that case, you should go for complementary feeding homemade food rather than giving this powder milk. So distribution of this powder milk packs by military or by police personnel or the frontline worker, I think is really very shocking to all of us, those who are activators or activists for the implementation of IMS Act. So these photographs in the COVID pandemic are really very distressing. What has happened is not only this photograph, mother is continuously under societal pressure not to breastfeed, but rather to give supplementary feeding. Non-adherence to facilities and healthcare professional, I think repeatedly Sneha Bhuyar madam was saying that if mother cannot directly breastfeed, she should express the milk and give it through the bottle. I think somewhere we have to change our concept. Unfortunately, this is not with 1 or 2 obstetrician or pediatrician, but almost every pediatrician has the feeling that if mother has less milk, she should give the feeding, and the top feeding or the animal milk is usually given by the bottle only. So somehow we have to prevent this. We have to advise that if milk is to be given other than mother's milk or even mother's milk after expression, it should be given with katuri spoon. There is no scientific indication for giving bottle feeding. Bottle feeding will not help to in any way, rather it can be problematic for the baby. So violation of IMS Act and producing companies is continuing, and unfortunately there is no action or proper monitoring of this. So there is a lot of lack of awareness on IMS Act, not only amongst the doctors, but also amongst the healthcare workers, amongst the government, and amongst the various authorities. As we said, though IMS Act bans promotion and manufacturing and distribution of bottle feeding, the uncontrolled bottle feeding continues. The use of bottle and formula feed is still rampant, not only with the parents, not only in the hospital, but even in the media. You can see out of these 4 photographs, the upper one single photograph is advertisement of a scooter, 2-wheeler. And 2-wheeler advertisement is showing bottle feeding. I don't know how you can approve this advertisement where the bottle feeding is shown for the promotion of a 2-wheeler advertisement. So what is required? We have to keep in mind that it is the right of the child, which milk he should get, how much milk he should get. It's not only child or baby's right, it is women's right also. And all those who believe in women's lib movement or women empowerment, they should promote the breastfeeding. As you can see in this photograph, where one of the model, she is promoting the breastfeeding rather than the bottle feeding. And this photograph says breastfeeding in public is not a crime. It is about the mother's choice and her baby's hunger, nothing more than that. So we should avoid all this type of promotion of bottle feeding, and we should promote basically the breastfeeding. We should motivate, counsel the relatives, build the confidence of the mothers and relatives, and remove any confusions or misconceptions. So please remember, feeding of the child is not a matter of trial and error. In the present era, the proper nutrition is mother and child's birthright, and so is the right in the COVID pandemic era also. These are some of the encouraging advertisements which you can see. So I think this type of advertisement should be promoted by media rather than the bottle feeding. So if breastfeeding is mother's and child's right, and not breastfeeding is child abuse or violation of this right. You can see this is a news, the first photograph with the Finland, which comes from the Finland. The good news, Finland becomes the first country to introduce 7-month parental leave for both the parents. So here is government giving leave for the child's care for both the parents, not only mother. The another one is mother is promoting breastfeeding in public places. Again, it should be promoted and not demoralized. There is an online petition for creating a mass movement. Ms. Jinsi Varghese from Mumbai, she said the right to breastfeed campaign and stop the feeding of formula milk without the parents' consent. So I think somewhere the parents, the health workers, they have to get motivated to stop the violation of IMS Act. And if you notice any violation, these are the various organizations where you have to report. We have the Central BPNI at New Delhi, Akash at Mumbai, Indian Council of Child Welfare and Central Social Welfare Board. These both are the Government of India's organization. And these 4 names are notified in the official government gazette. Besides this, we want that IP and IYCF chapter should be included in this list. And of course, the Human Milk Banking Association of India should also be included to report the violations. So finally, before we come to end, let us understand what is our responsibility, what is our duty. We have to strengthen the health system and community programs. We have to remember breastfeeding is natural, instinctive and physiological. It's mother's as well as child's birthright. Many times, otherwise the mothers have to do protest feeding or feeding in public. We should not be blind followers of the Western culture. Parents and health worker concept must be clear. So what is important? We need a lactation counselors. We need a support group. I must compliment BPNI Maharashtra for having a strong mother support group. And now we are saying even about the father support group. We have to establish human milk bank, at least initially in all the district headquarters, and only IMS Act cannot be the answer to all these problems. So we have to have a mass motivation, we have to have community participation in order to promote, support and protect the breastfeeding. And these are some of the examples. In Rajasthan, they have said no discharge from the hospital if woman is unable to breastfeed. The second photograph is from the military personnel, a mother feeding the child. The third photograph is of the father support group, as we say, can see a man breastfeeding the baby through the syringe and the tube. So he and the baby, there is a milk in the syringe, and through the tube it is going to baby's mouth, but he is a male person. Even in Bihar, बिहार के अस्पतालों में नहीं मिले दूध, सरकार ने लिया फैसला स्तनपान अस्पतालों में बनेगा स्तनपान वार्ड. So this is what government has to do. So I hope all of us should take a place today that we will not leave any stone unturned for promoting, supporting, and protecting the breastfeeding. And at the same time, we should pledge to avoid bottle feeding or formula milk unless and until it is very, very essential. And as we discussed, there is no indication for bottle feeding. If you want to give any other milk rather than the mother's milk, it should be with katori spoon or with the cup, and directly with the cup or the glass. So before I finish and before I thank the Alive and Thrive, the FOGSI, all other organizations, the breast group of the FOGSI, and of course the BPNI Maharashtra, IYCF chapter, Indian Milk Banking, I will complete today's presentation. No matter how long you traveled in the wrong direction, no matter how many mistakes all of us have made, we can always turn around, go on a right path, and promote, protect, and support the breastfeeding, and let the words or the IMS Act be implemented in spirit and not only in words. So spirit of IMS Act is very important. Thank you. Thank you again.
Yeah, thank you so much, Tiwari sir. Very nice, very clear, and in a simple language, very self-explanatory, nice pictures. And thank you so much. And I'm sure there will be a lot of questions for you at the end. Thank you. We'll take later. So now I request Mandakini madam to introduce our next speaker, that is Dr. Ketan Bharadva.
Yeah.
Mandakini madam.
So good afternoon, everyone again. And at the outset, I really like to thank Dr. Tiwari for such a good, explaining the act.
Vishal, please unmute everyone.
Yeah, most of our attendees are not aware of the acts. And this is quite a new act. And I remember that Nestle's were, that time promoting, so many baby foods. And suddenly, there was a stoppage and a lot of action was, because I was also in charge for the this baby friendly hospital as a Kama hospital superintendent. It started in 1998 when Dr. Fernandez was there. That time it has started. Sneha. Then I am associated with it, and I was in charge for certifying the baby friendly hospitals and looking all the criteria. So Dr. Tiwari, wonderful. I think you will be having a lot of questions. Now I'm going to introduce our next speaker, Dr. 1 minute, just a minute. Next speaker, very senior pediatrician, Dr. Ketan Bharadva. Dr. Ketan Bharadva is a director of the Masoom Children Hospital. He is the president of Indian Infant Young Child Feeding Chapter of India. He is a Human Being Banking Milk Association, and also he is the coordinator for the breast feeding agencies. He is a national trainer.
The Bluetooth device is ready to pair.
He has been awarded the Limca Book of Awards for collecting very important for breast milk donation camp. Highest number of breast milk camps was held by him. He is holding the Limca Book of Records. He is WABA Gold Medal 2008. He is a fellow of Indian Academy of Pediatrics. IAP. He is author to many publications. Very important learning disability training test books, chapters. Then he is visiting faculty for many an examiner. So floor is to you, Dr. Ketan, and we will be very happy to listen to you. Please.
Yeah. Very good evening to everybody. Vishal, can you load my slide deck? So I am very thankful to the Federation of Obstetrics and Gynec and the International College also of the same. I'm thankful to BPNI Maharashtra and Alive and Thrive to bring this program to us. And of course, to the breast committee, Dr. Sneha and all. Next slide, please. Vishal, please, next slide, please.
Bye.
So, friends, we all have discussed that human milk is so important for us, and I will not go into depth of it. But when the mother's own milk is not available, we have to use. There are about 85 human milk banks in India, so there are many centers who are having this facility, and they should use it to the most. Next slide, please. Vishal. So in this pandemic, what we have seen is that a lot of attention has been given to scientific aspects of so many disease vulnerable populations, including pregnant women. But there is much less has been attended in infant and young child feeding. We have to concentrate on two aspects of infant and young child feeding, especially the breast milk, whether it is harmful and giving vertical transmission or not, and whether there are any protective role of antibodies and other immunoprotective factors which are there, which can work against the COVID. Next slide, please. Yes, Vishal, next slide, please. So we will go fast through certain facts and hypotheses. First is that about the viral transmission via human milk. In the history, it has been well established that human milk can transfer viruses, and the examples are HIV, cytomegalovirus, HPLV we know of. Even the corona, the ubiquitous common cold corona 229E can be transmitted through human milk. But the experience with SARS-CoV is that no viral RNA was found in human milk. Though there are antibodies identified in human milk, but then there are no vertical transmission cases noted with SARS-CoV. So far as MERS is concerned, MERS, there are no report of the presence of virus in the human milk, but there has been one report of transmission to human through camel milk. So with this, there were many doubts about how this corona would spread. Next, please. Vishal, next slide, please. So, friends, the ACE2 receptors through which the COVID enters into the host cells is found in mammary epithelial cells. So, there has been hypothesis that the viral viruses may pass into the breast milk through the breast milk. Or there may be even reverse transmission from the infected baby to the mother, just like what happens in the HIV and Ebola. Next, please. Vishal. Hello. Vishal, next slide, please. So, the evidences which are found so far are that from amongst the 20 samples which have been studied in 9 studies of positive COVID mothers, no sample has been found to be positive for the COVID. The breast milk has not been found. Till far, no antibody tests have been done in breast milk in any of and the transmission has not been demonstrated in these Chinese studies, nor has been reported by CDC, and they have declared that there is very less probability of transmission of COVID. The MERS coronavirus inactivates at 60 degrees for 30 minutes in camel milk, and the US FDA has declared that all the food and food packaging are not the vectors. So with all these evidences, next slide, please, Vishal. I would like to tell a few facts about the heat sensitivity of the COVID viruses. That they are very readily inactivated at 56 degrees centigrade for more than 30 minutes. So this was a promise that with 62.5 degree with the pasteurization processes that we are using, there won't be a possibility of transmission. Next slide, please. Similarly, whatever the containers we are using in human milk bank, the steels and plastics and glass, we can see here that the virus doesn't remain viable beyond 4 days on steels and plastics. Next. Vishal, next. On the glass also, it doesn't remain beyond 2 days. And most of the milk banks, they use the glass Pyrex containers. Next. So there are few issues now in testing of the human milk so far as COVID is concerned. The RT-PCR is neither designed or validated for human milk because of the substantial contents of the fat, DNAs, RNAs, and there are other PCR inhibitors. And the silica column method of the RNA isolation is met for only a small amount of sample, whereas the milk samples, they are larger. Even there are no substantial protocols made for collection and handling of the milk samples, and that may be a cause of false negatives till now. And there are no data on when you should store the milk as a frozen and how far the virus remains stable within the milk, even if it is present. And if there is a very, very low milk load, viral load in the milk, there might be false negative tests also. There are no correlations yet found between the antibody status of the mother or the breast milk and presence of communicable viral particles in the breast milk. Next, please. Vishal, next, please. So, friends, now let me come down to the core of my discussion that human milk banking is a system of collecting and processing and storing the human milk to be donated to recipients. But then the whole system, because of COVID, is facing bioethical issues. With mothers knowing and having fear about COVID, which may or may not be transmitted through milk, even the healthcare workers, they show a lot of paternalistic behavior as far as use of human milk is concerned. So the autonomy, the whole autonomy of the system of this therapy. Similarly, the beneficence is not compromised, but then there is a possibility of non-maleficence if there are possibility of viral particles transmitted to the newborn. And ultimately, due to the shortage of the milk supply in the donation, the justice may be compromised. Next, please. Vishal, next, please. So there are breastfeeding guidelines given by the WHO, FOGSI, NNF, even our Human Milk Banking Association, but there are no explicit guidelines given for human milk banking, not even by the US, Europe, or our own Indian guidelines, because there are no much confident evidences regarding the presence of this virus in the donor milk to be used as a therapeutic agent. Next, please. Vishal, next, please. So, friends, we have to ensure a safe donor milk with the use of the HACCP, the hazard analysis control points. We have to analyze and see where we can reduce this hazard. So the first point in the milk banking, that is motivation, screening and collection and transport of the donated milk to milk bank. How do we go about it? Next, please. Vishal, next, please. Thanks. So the donors, they are now fearful. Even if they are not fearful, the number of donors have reduced because most of the donors used to come from the admissions within the hospitals, and number of the admissions have reduced a lot. So the donations have come are becoming less and less. Even those donors who want to send their samples, donations from home, due to lockdown, there are a lot of transport issues, and even there is lowered motivation among the donors to donate now. So the overall pool of donors is reducing, and most of the banks, they are afraid that within short time their whole the donated milk supply will go down and they will run dry. Next, please. I'm so sorry that we have to pause in between. So friends, there has been formulated few COVID screening points which should be applied before taking donations. The main they are saying as written over here is there are exclusion criteria to be included in the donors qualification list. That is, the COVID positive donors till they are declared free of infection. All those donors who are who have stayed or transited in high containment zone, or all those donors who are in contact with the patient or are there in contact with healthcare who are taking care of COVID positive patients, and those donors who are having symptoms of influenza-like illness should be excluded from the donation process. This is a very logical argument. But then there is a provision that all the donors should be screened universally for COVID. But practical situation is very different. Next, please. Vishalji, next, please. So the practical situation is that most of the patients, they are withholding their status of even symptoms or contact out of fear of logistics, which would happen after declaring this thing. What will they undergo in the quarantine and whatever testing process, and they're very afraid practically. And another practical issue is that there are restrictive protocols for lab testing. So we cannot test all the donors for COVID lab test because there are no provisions for testing donors in this ICMR guidelines. And similarly, there are many asymptomatic carriers. So with all these problems, we can never know that which donor is positive and whose donation is going to be positive. So a solution has been worked out by people that collect the donation properly as per guidelines that I will be giving just now in next slides, and preserve that donation for 2 weeks in an earmarked area, and then after 2 weeks, again contact the donor and ask whether there has been any symptoms or positive tests or whatever it may be. And if there has been some positivity, then discard the sample, and if not, then you push it for further pasteurization. So now, what are the collection guidelines? There has to be strict personal hand and respiratory precautions with the donor and the assistant who is helping the donor to collect the sample. There should be a very clean collection area, and the bottles should be clean, and if possible, they should be sterile. And the donor should use a dedicated pump. They should not use a common pump with anybody else. They should not exchange pumps. So the milk banks who have got common pumps, they would be discouraged to use those common pumps. But then they should use manual expression method. Now the problem is here is that the donors, they need to get in practice with manual expression. They should learn to pump more and more of milk. And even if the donor has got a personal dedicated pump, they should be properly disinfected and sterilized. Now after collection, the collected bottle has to be kept in a clean storage bag, being held open by a second clean person who is not touching the donor, and then that bag has to be transported to the human bill bank. Next, please. Vishal Bhaiya, next, please. Then there has been a question that if there is a contamination of the container by even if externally, then it has to be cleaned by some disinfectant or not. Most of the hospitals have been advised to use hospital-grade disinfectants for broad antimicrobial action on the medical equipment and on high-touch surfaces. remember, high-touch surfaces. But the human milk containers are not high-touch surfaces. So once there was an advice in some journal of human lactation that you should use sodium hypochlorite to wipe off the containers, but then this is discouraged. Sodium hypochlorite at 0.5% is 5,000 ppm, and whereas the maximum allowable content should be not more than 200 ppm. So sodium hypochlorite on the feeding bottle
Hello? I think the internet connection has been lost. Hello?
Hello.
Vishal, the internet connection has been lost.
Yeah,
hello?
Now I'm back.
Yeah, okay.
So the for the clean food contact surfaces, they should be cleaned with soap and water, or better, warm soap and water, and that cleaning is enough. Next, please. Vishalji, next, please. Hello, Vishal, next, please.
Hello, what's the problem?
I think the connection is lost at his end. I think so. Connection is lost. Let us wait for a minute or so. Connection is
Connectivity issue. Am I audible?
Yes, you are audible.
Hello.
I think again the connection. They have put a poor connection there. Connectivity is
Hello, hello. Yeah. Till now there was a very good connectivity. I think everybody.
Yes, we can hear you actually.
Yeah. You can finish now. There is.
Just hold on. Let me
Go ahead. Please go ahead.
Am I audible now?
You are audible actually. Problem with Vishal's end, I suppose. You can continue.
Now, so far as precautions, milk bag is concerned, we should ensure the proper environmental cleaning and disinfection procedures which are routine with the human milk bags, and as with all non-high risk areas. So this is very important, and there should be strict personal hygienic procedures at all the stages of processing of the milk, right from collection to dispersal. And the personal protection equipment that the staff they usually use is definitely the masks and caps and gloves. They are routine for human milk banks. But then the comprehensive lactation management centers which use they do group counseling and mass donation, they should be discouraged, and they should be encouraged to have more of telecommunication. Next, please. Vishalji, next, please. Hello. Yeah. Once the sample or the donation is there in the milk bank, usually there is an aseptic milk transfer technique of the donation into the flask within the milk bank, and then there is a pooling of milk. So once the milk is there within the milk bank, the chances of transmission from outside of the container also is reduced. Next, please. Yes, somebody has put up a question that we will answer at the last. So now in the milk bank, the older pasteurization is done, and which means the viruses is our hypothesis at present from the evidences found from the heat stability of COVID virus. But then remember that these stability studies are on the surfaces of glass and plastics and what other matters. These stability evidences are not for any sort of milk, either animal milk or human milk. So we need more evidences for it. That's why somebody asked that why you want to discard the milk from the COVID positive donors who are found at a later date. This is the reason, because we do not want to harm the baby in any way. First, do no harm is the principle of non-maleficence in our bioethics. So this is the reason. Next, please. And that also was a legal issue. Next, please. Vishalji, next, please. So then ultimately in the human milk banking process, there are cultures being done and the storage is done in deep freeze. These are all processes, they are not affected by the COVID situation. Next, please. Vishalji, next, please. One of the most important things is record keeping and tracking. Again, we still don't have 100% sure evidences about the safety of the milk. So we do the things in good faith and with present available evidences and the science. But then good record keeping and tracking will be helpful for us to take care of any mishaps, which we can find it a later date also. Next, please. Vishalji, next, please. Hello. So there will be a situation in case of shortage that the pasteurized milk will have to be
6 वाजताची सध्याच नाही द्यायची, थोडं आणखी अर्धा तासात मी पाहिलंय.
Vishalji, next, please. Vishalji, next, please.
Yes, it's done.
The last slide now, I think. Hello. Madam Sneha, am I audible?
Yes, you are audible. Only the slides are not moving. Yeah.
The last part is that all the human milk banks will have to address the possibility of reduced healthcare staff or the workforce within the milk bank. We will have to also address the issues of low shortage of PPEs in the milk bank and many other logistics they will have to address. In summary, the human milk donation continues to be supported in accordance with and as per requirements of the national guidelines for human milk, comprehensive human milk centers or the lactation management centers, and the Indian Academy of Pediatric Guidelines, which have been published. But with a special precaution in screening, in collection, and to have a change in the distribution policy if needed in case of shortages. And there is no need of hospital grade disinfection of the container bottles. This is the summary. With this, I thank all the delegates. I am very sorry because of some poor connectivity issues that have occurred of late in my presentation only. Anyway, I am thankful to all of you for listening. I will be happy to answer the questions. Thank you very much.
Hello. Thank you, Dr. Ketan, for that wonderful presentation. And I think our attendee are having a lot of questions here. Mangala, can I go ahead and read the questions here? Mangala, you are unmuted. You are unmuted.
Now, can you hear me? Yes, Mandakini madam, you go ahead and ask the question. There will be a lot of questions.
Yeah, 1 minute. I'm just seeing the questions here. Okay. One minute. I lost the connection. 1 minute. Mangala, you can start because I lost the connection. You can start reading.
Okay.
You can start reading. I'm just trying to rejoin, you know.
Yeah, somebody has asked about the wearing the mask of the mother. See, what type of mask she used be using, the COVID positive mother while breastfeeding? And another thing, does the baby needs to wear a mask? So maybe Dr. Pradnya, who has a practical experience, she can answer this question. Vishal, please mute everyone and unmute Dr. Pradnya.
Yes, sir.
Actually, I have covered this in my talk, so I would like to answer this question.
Madam, I'm so sorry.
Answering
even
Pradnya, just wait.
When the mother is COVID positive, we have said even if she is suspected or confirmed positive, she has to follow hand and respiratory hygiene. That is what I had mentioned in my talk. So by respiratory hygiene, we mean that she and the baby both should wear the mask and she should not cough and sneeze everything. So we address this issue of mask. Whenever she is COVID positive, she has to wear a N95 protective mask so that she should avoid transmission of the disease to her baby and to the community as well. So she has to wear N95 mask, that is for sure. Even the baby should be asked to, rather baby should wear the same mask to avoid the transmission from mother to baby.
Okay. I think, Sneha, I won't agree about the baby wearing the mask. Maybe I do not know what the other speakers they think.
No, baby has to wear the mask because it is respiratory hygiene. Naturally, when baby is feeding, we have to remove. Baby has to wear for rest of the time. During feeding, how the baby can keep the mask, but rest of the times, the baby has to. We have to make the baby use the mask. Regarding the practicability, I think maybe Dr. Pradnya has a better experience and she can share.
Madam, sorry to really contradict you here, but no guidelines actually recommend the baby wearing a mask. And the practical problem that we would really face here is how do you make those masks? I mean, we do not have neonatal masks which are really available. So that will be one practical issue. Actually, and as far as N95 masks are also concerned, means definitely the transmission rates while using a N95 mask will be less. But even as long as the mother is wearing a plain cloth mask and maintaining proper hand hygiene, that itself will decrease the transmission to a great extent. So as long as these two factors are taken into consideration, I think that should be more than enough for preventing any transmission.
This is as far as the practicability is concerned, but what guidelines we have taken, you know, these are from their guidelines themselves and these are actually copied with the pictures. They have actually said that the mother and baby both should wear masks, but as you have said that definitely practically considering we may not get even the N95 mask and we may not use even the simple triple layer cotton mask will be adequate for prevention. That I agree with you. But when we talk about ideal situation, we talk about guidelines, we have to say what is ideal. Thank you.
Next question is to all the panelists. from Dr. Kuthe from UNICEF. His question is regarding districts where human milk bank is not available and mother is very in critical condition and she is not able to express her breast milk. So what should be the alternative? So any one of the panelists, can you please answer this question? Where the human milk banks are not available. So any alternative you can suggest? Yeah. Dr. Ketan.
Let me answer. Yes. WHO has given an interim guideline that you can use wet nursing. Now, what would be our advice is that you can use wet nursing in absence of a human milk bank, provided you are able to screen the donor with HIV, HCG, and VDRL before taking the donations, and a proper consent should be taken from the recipient also. So with that sort of arrangement, wet nursing is being promoted by WHO officially in their guidelines.
And again, one more question, very important question, Dr. Ketan, for you. This is why to discard milk of COVID positive or suspect mother when there is no sufficient evidence of virus in the milk? That is a question to you, Dr. Ketan.
Yeah. Now, again, we are not having thorough evidence. Remember, whatever the evidences are there, they are anecdotal evidences. There are no studies which has been done to qualify that the milk is totally free of these viruses. What I also mentioned, the full slide of what are the deficiencies in testing the human milk for COVID. Right from in the how this RT-PCR can be fallacious in diagnosing the COVID because of the absence of the standardization of this test for human milk, because of the lot of fats and anti.
Okay. Now the question to Dr. Tiwari.
There are many anti-PCR factors in the human milk which can lead to false negative tests.
Okay. Dr. Tiwari, you have a question here, very interesting.
There has been no standardization of collecting the samples, preserving the samples. So with all these things, the evidence is built up for 100% confidence. It is our duty not to do harm first just without evidence. So that was the reason behind starting the sample if it is from a COVID positive mother.
Okay. Okay. Now the next question is to Dr. Tiwari. The attendees are asking for the act in a very simple language. Also give the Government of India website link and whole of the act of the IMS. So if you can give it to us at the ICOG, actually we have a website. We can put it on the website for the benefit of the.
Madam, we'll send you the copy of the act, and it's available on Google search also if you go. But we'll send the copy of the act to Mangala Wani madam and other organizers.
Yes, yes, thank you, sir. And we will forward that to Mandakini madam, and which can go to the ICOG website. And it will be great help, madam, because lot of people will be aware that there is act. At moment, people don't know there is act like this.
Yeah. No, all the lectures here are going to be on the website, Mangala and Sneha.
Yes.
Yeah, yes. We have a special module, and all this module will be put in the breastfeeding, subtitle. So everybody,
yes.
It will be so nice.
We'll do it.
Yeah. So I think I don't see many of the questions. Can you see it?
Yes, I have one more question. Somebody has sent me. One of the option when the COVID mother is too ill, that time she cannot breastfeed the baby. But once she gets better, now she can again start feeding the baby. But there is no milk. So there is something called relactation. Means we can start the lactation. So can somebody explain how did this relactation is being done?
Yes. I will answer it. Relactation actually can be done very easily in mothers who are already lactated once. Even you can start lactation in women who had delivered many years before. And there are anecdotal examples of grandmothers feeding their grandchildren in certain accidental cases. So there are all the chances that you can re-establish the lactation. Now there are principles of establishing the lactation again. So the most important principle is the mother should go on feeding the child, putting the child on the breast every 2 hourly or 2.5 to 3 hourly, so that more frequent and complete emptying of a breast occurs, and the child remains on skin-to-skin contact, and oxytocin reflex is very easily established. And with this, the certain medicines may help. I tell you, it may help, but more important is frequent emptying of the breast by the child on the skin-to-skin contact with the mother. You may add domperidone in this mother to augment the breast milk secretion. And the mother should be held and be given full confidence by counseling. And she should be made stress-free by other methods so that the breast milk secretions can improve. She can be helped by even certain back exercises and back stimulation and massage of the breast and hot fermentation of the breast, and all those techniques, they help in establishing the breast milk again. So with this, the practice is within 3 to 6 weeks, most of the mothers, they can have enough of breast milk again.
Yeah, thank you, Ketan.
In fact, in my talk, I have projected one slide where the COVID mother is critically ill. I had given 3 options: relactation, then the wet nurses, and donor human milk, that is human milk. So addressing this question, that what are the other options, that is relactation and wet mothers. So sir has already clarified what is relactation. So naturally we can use wet mothers, that is the mother who has delivered a baby, who is already feeding her baby, and she can also feed that baby additionally. So that is how we can use these 3 options. If we do not have human banking, we can use these 2 options.
Yes, Dr. Sneha. So about this relactation, it is a process. It can happen. And that is where the lactation consultants, they are the specialists, they come into the picture. I think such cases should be referred to them and they will do the proper job. Thank you.
So I would like to add something here. In my talk tomorrow, day after tomorrow, on from bottle to breastfeeding. So I am going to cover certain techniques where the baby can be brought back to the breast.
Just to clarify, can I ask a question? Yeah, last comment from me. Just to clarify what precautions I had talked about when the mother is COVID positive, critically ill. We have to express her breast milk and feed with a COVID negative mother or a caretaker with the help of breast pump and utensils. I had said utensils. So you have to sterilize the utensils. Follow proper hand wash, respiratory hygiene, and sterilization of the utensils. So it can be vati and spoon, vati samsa. It can be other utensils what we can use. But definitely some of the presentations as older one, they are still maintaining bottles, but we have to skip bottles. We have to feed it with vati and samsa. Okay, thank you.
Even Sneha, babies directly take cup feeding also.
Yes,
beautifully.
yes. We are doing
So Dr. Prashant Gangal wants to make some comment. Dr. Prashant, are you there?
Unmute yourself. Unmute yourself.
Hello.
Vishal, will you? Yes.
Am I audible?
Yes.
Yes.
Okay. I want to ask a question to Pradnya Supe, that the mother is normal, she's asymptomatic, she has no family members, have no symptoms. Suppose a mother, normal mother asks you a question that am I supposed to wear mask inside the house while breastfeeding or taking baby care? Now the corollary to this question is that our family members, the normal family members, mean no symptoms, do they wear mask inside of the house?
So actually, the thing is, the practical issue here is the government is not really testing asymptomatic patients, at least in our. So even if these are family members of COVID positive women, they are not being tested. But
No,
yes,
I'm not asking that. I'm asking that in a normal family where there is no fever or anything, there is no reason that why they should go out and test. Are they supposed to wear mask inside of the house?
Sir, if the mother is a diagnosed COVID positive mother, yes, sir, it is advisable for them to wear
I'm
masks
asking
in
normal
house.
mother. A question asked to me by many normal mothers. Do family members wear masks when inside of the house?
So normal mother, if she is not a COVID positive patient, sir, I don't think it is really required.
Right. That means that the recommendation for a normal mother and normal baby is that when they are inside of the house and nobody is positive or everybody is asymptomatic, the mother doesn't wear the mask while breastfeeding or doing baby care, right?
So we have said only suspected or confirmed positive COVID.
But then that message has to go clear. A normal mother with no symptoms doesn't wear mask while breastfeeding or baby care. Otherwise, every mother will start wearing mask inside the house even while breastfeeding, and she won't even kiss the baby or hug the baby also.
Yeah, it's only suspected or confirmed COVID. That means normal mothers should not wear.
Yeah, that is a point I wanted to make.
Yes.
Yes, sir.
Thank you.
Yeah, another question to Dr. Ketan. You have shown in your slides that manual expression is better. But if you see the practicality, most of the mothers who donate the milk, they express with the pump. So how easy it is for manually expression? And even I think if they don't keep the hand hygiene, so I mean, it may not be very good idea manually expression.
Yeah, very basic thing is that even if you are using a pump, hand hygiene is a must. So if it is manual or pump, hand hygiene remains safe. Next thing is that the pump has to be a dedicated pump, and you cannot use a common pump of a human milk bank for all the mothers in some situation. So this is practically not possible to give a pump to all the donors a dedicated pump. So this is not possible at present with the human milk bank. Thirdly, the pumps in general, they are not as safe as manual expression with proper precautions. Pumps overall are more associated with higher infection rates and higher contamination rates world over. So manual expression is far better. Now the only issue is that the mothers have to be taught proper manual expression, otherwise the quantum of the milk expressed may not be as good as pump. Even if the mother doesn't do a proper manual expression, there are chances of herself injuring and causing pain in the breast. So the most important thing is that the mothers should be taught proper manual expression and the techniques. Then they are as good as or even better than pumps in all the circumstances.
Right. Okay.
Can I have a question for Dr. Bharadva?
Yes, sir.
See, normally all the viruses get killed by proper pasteurization procedure. So even if we presume that there is a HIV virus or whatever virus, like COVID virus, I too believe that if the milk bank is following proper pasteurization process, what is the fear of using milk from, let's say, asymptomatic mother who is a donor and we are not testing her? We are doing pasteurization and we are taking all the precautions to kill most of the viruses and bacteria. So why special treatment for COVID positive, suspicion that there might be COVID in asymptomatic mothers?
Yes, sir. This is a dilemma because we are dealing with a novel virus. So we don't know what exactly are evidences for this virus, but we are applying all our past wisdom and experiences from other viruses and we are applying it to this situation. And this is a therapeutic situation. So in therapeutic situation, there has to be a lot of caution exercise till the evidences are built up. But then still, we are propagating that use more and more of human milk, pasteurized human milk when mother's milk is not available. So we are not denying the fact, and we are promoting pasteurization. But to be on very safe side, if suppose if you are really going to counsel a mother or a recipient, that this is the situation that is going on. If somebody asks you that what are the evidences that there is 100% guarantee that this milk doesn't contain COVID, then you are nowhere. So for all those situations, these are the answers.
You mean to say there is no data on killing of virus at what temperature it gets killed, or whether pasteurization neutralizes the COVID virus, right?
No, there are no studies or no anecdotal study also, a single study also on effect of pasteurization or heat treatment of presence of COVID virus in the human milk. There are no studies.
Okay, thanks.
So next question is to Pradnya. So in Sion Hospital, did every COVID positive mother breastfeed the baby, or were there some mothers who refused to breastfeed?
So most of them, madam, have breastfed their babies, and those who had a few doubts, they were counseled about the same, but we had no mother who did not feed. However, we did have around 5 mothers who were extremely critical, and they were in ICU care. So the babies had to be kept in NICU, TCU, or in our nursery. And these babies were given express breast milk or donor milk from our milk bank, madam.
Right. Okay. Thank you so much.
Yeah, ma'am, I would like to add one thing about masks. Even for those who are taking care of COVID patients, positive patients, the ICMR recommendation or the recommendations are for using a surgical mask, not an N95 mask for everybody. It is only for healthcare care workers who are exposed to aerosol generation. While during procedures or nebulization or intubation, they should use N95 mask. So the mothers should go on wearing triple layer surgical mask. That is the recommendation. And for babies, there are issues with masks that there are possibilities of suffocating the baby, and still there are no 100% sure methods to protect the baby. So there are no explicit guidelines on using N95 masks that we know of for babies or even the mothers who are feeding the baby.
Right.
I think this is a slide where I have specifically mentioned that donor human milk is pasteurized, but there is no evidence whether it kills COVID-19. This is a point which is very valid, and we have to accept that whether it kills COVID-19 or not, what Dr. Prashant Gangal had asked just. Yeah. So I think...
yes. I think all the questions are over, and we are already half an hour over our time. So we will, I think, stop here, Sneha. Is that okay?
Yes, yes, absolutely fine. We had almost 760 registrations today. There was some difficulty in logging in. So please, I request the admin to take care of this issue today itself, so that, tomorrow we do not have any problem in logging in. I thank all the dignitaries, Dr. Alpesh, Dr. Jaideep, Dr. Mandakini Madam, Dr. Parag, Dr. Ragini, all our speakers today, and Dr. Prashant Gangal, Dr. Bharadva, and Dr. Pradnya, Dr. Deepti Shah, all our esteemed speakers and all the panelists, all the viewers. I would like to thank you from the bottom of my heart. Thank you so much.
We have to make some announcement.
Yes.
Yes. I have to make some announcement.
Yes, definitely.
Yes, yes, madam.
From the ICOG, I have to say that all the attendees who are attending, they have to attend for all 3 days. At the end of the 3rd day, you will be given the multiple choice questions, and the methodology will be told by the website person, and you have to answer those questions, and those who answer the question only will get the certificate of ICOG. So those who have attended, please attend tomorrow and day after. Your attendance is being noted here, and the person who has attended all 3 days will be given the multiple choice question, and those only will be given the certificate. So very important information. So I think I conclude. And also there are a lot of praise, and there are a lot of appreciation for everyone, especially for Sneha, Mangala, PPIN. That such a wonderful initiative has been taken. I am very, very delighted to be associated with this organization and offering the certificate course, so that all the attendee can proudly display that certificate, which is a very prestigious certificate of ICOG and FOGSI. So with that note, thank you very much once again.
Yeah, thank you very much. Yeah,
Thank you so much. Bye-bye. See you tomorrow.
Tomorrow is a very important session about the baby-friendly hospital initiative. So we look forward to see all the delegates and all the speakers. Thank you very much. So see you tomorrow at 4 o'clock.
Thank you.
Bye.
Thank you, madam. Bye.
Thank all the delegates. Those who have got some few queries may post us on our personal WhatsApp. No issue. Thank you.
Thank you.
Thank you, madam. Thank you so much.
Thank you. It was really great. Only little bit practical hiccups. Even I couldn't get into my laptop. Ultimately, I had to do it on my mobile, which I was totally unsatisfactory, but I managed. So tomorrow I make sure that my laptop is on.
So, yeah, I sincerely apologize, ma'am. I hope there should be no problem tomorrow. Also expect actually speakers to join slightly ahead of time, so that there are no challenges. Anybody calls during the webinar, it makes difficult to look at the screen, manage, and also attend the call. So I sincerely apologize for that. But yes, I tried my best to this to be a successful program.
So, Vishal, is my name still showing as a Dr. Prafulla? Because there is a lot of comments I see. Thank you, Dr. Prafulla, because I am using my husband's mobile where I could log in. So myself, I'm Dr. Mangala. I'm not Dr. Prafulla.
Yes, it's showing Dr. Prafulla, but it's fine, ma'am. Tomorrow you can try with your account. Yeah.
Yes. Okay.
Mr. Vishal,
I'm ending the broadcast because
you at least half credit you will get.
As always.
For Dr. Prafulla, half the credit goes to Dr. Mangala.
Thank you, sir.
So I had a question. The presentation has to be sent to you, Mr. Vishal, or I can operate it on my own when I have it day after tomorrow?
Manisha, you can operate on your own.
Yes, okay. I would prefer to do that, yeah.
But as a safety precaution, you also mail him your presentation. So in case there's a last minute problem, he can always put your slides.
Okay, done. Yeah.
The only problem is, when I run a presentation, there is a time lag of few seconds, 3 to 4 seconds.
Yeah. I realize that. Correct.
So, if you will make
and so, Dr. Ketan, I just wanted to share, I am trying to recollect which study. There has been a study where they have shown that the virus got destroyed after heating the milk for at